Thank you for the nice introduction. Hello, everybody from very late in the evening in Los Angeles. Okay, so I am going to talk to you about two different topics tonight. The first is avian physical examination. And just to put things in perspective, from my understanding from the folks that I know who are your carers over there, that some of you that are probably attending, so Fiona O'Sullivan, Kathy Gilmore, and several other people. It sounds like you guys face a lot of the same challenges that we face in wildlife rehabilitation in North America. So it seems like a lot of our experiences are very shared. So we'll explore some of that. And with that, I will get going here. And I will be up for questions and such later. I'm also up for email, and it occurs to me I didn't stick my email address on my slides, but I certainly can get that to all of you as well. All right, here we go. Oops, there we go. All right, so this was written by the National Wildlife Rehabilitators Association and International Wildlife Rehabilitation Council as part of their standards for wildlife rehabilitation. So the goal of wildlife rehabilitation, which I think is the same for you guys, is the treatment and temporary care of injured, diseased, displaced indigenous wildlife and their subsequent return of healthy animals to appropriate habitats in the wild. So we are not in the business of creating thousands and thousands of disabled animals, which we certainly could do if space were available, but it isn't. So here's one of my cases. So this is an ideal case, kind of the way it goes. We have one of our California brown pelicans comes into care, hideously injured, obviously would die without care. We've patched the animal up and get it released. And thankfully, my organization does band all of our released animals. So we do have excellent follow-up data on many of these animals. And sure enough, somebody sent us a photograph of this bird standing around in the wild almost a year later. So this is kind of the ideal outcome for our wild patients. We have a lot of different reasons that animals come into care. I had hoped you guys weren't quite as afflicted by cat-caught animals as we are in North America, but it's pretty bad here. The other wildlife centers I have worked at, we typically saw maybe a third to half of all the animals that came in the door had been caught by cats. And I mean, thousands of them every year. So they're lacerated, they have infected body parts, they might be broken. Some of them are salvageable and some of them aren't. We also see pretty much very similar impacts of fishing hook line injuries with entanglements here. That's primarily what I do. That's what my workload consists of mostly these days. We also have animals that are hit by cars, they hit windows, power lines, etc. And we also have a lot of animals coming in with random fractures. We don't know what they were caused by. Miscellaneous wounds, maybe ran afoul of another predator. With all of our similar problems with wildfires, I think we're all dealing with some burned animals as well. We get more birds that are burned by some of the methane gas burners that are on some landfills. Those are typically more of a problem for birds here in California than actual wildfires, but we did get a bunch of swans with burned feet from some of our large fires. We, of course, all get a lot of sick animals, bacterial diseases, lots of parasite loads, viral diseases. We've been finding that with the droughts in California, it seems to be clustering animals into smaller and smaller amounts of water sources. So there are definitely some changes going on in the parasite communities that go with our animals. We certainly see lots of animals that are contaminated by glues and oils and sticky traps and all sorts of stuff. Plus, I know the Western Australia folks deal a lot with botulism. Here in California, we have domoic acid producing harmful algal blooms. In Florida, there's a lot of other types of harmful algal blooms that are a big problem, general toxins. And then all of us probably also deal with post-migratory exhaustion, bad weather events where animals get blown in or blown out of place. Sometimes quite a few like shearwaters and such will wind up in Arizona of all places when there's a storm off of Western Mexico. And then, of course, a big chunk of our workload are orphans. And many of these animals just come in to care. They may be injured, but they may not be. They might just have baked on a sidewalk for a little while, and they're hyper or hypothermic. They might be massively dehydrated, starving to death. And then there are also some that might come in with developmental problems, and that might become apparent when the animal tries to fledge. And of course, the general public, well-meaning generally, may kidnap some animals. And there also may be some genuine orphans where the parents have been killed. I have found in all these years that if there's an adult animal that allowed itself to be caught and it doesn't have a behavior problem where it's bonded to people, there's probably something wrong with it. If you're not finding anything, look harder. I often tell people to re-examine it like it's a new animal, because it might be missing something, some reason for it to be in care. And sometimes that might be vision. It might need a more detailed ophthalmic exam. So yeah, I deal with fishing line injuries every day, pretty much. Like, healthy orphans are not my thing anymore. They were for the first 10 or 15 years I did wildlife rehab with birds. But yeah, now I only see the sad cases now. But that's the burden of being the vet, huh? Okay, so in order to treat a problem, first you have to find it. And I found at least US vet schools don't teach people much about birds. If we do, it's parrots and chickens, and really just focused on pet animals and livestock animals. So I have learned almost everything that I know about birds from wildlife rehabilitators. So long before I went to vet school. So sometimes rehabilitators will think that an animal has to have an x-ray in order to find a problem. And that really isn't true. It's great for those animals that might be gunshot or have a really hard to diagnose fracture, or may have ingested fishing gear. It's great for those things. But in many cases, especially with the super small birds, your fingers are the best imaging apparatus that there is, really. And a careful, gentle exam can find all sorts of problems that you aren't going to see on x-rays. For example, if an animal has a shoulder range of motion problem, unless there's a fracture, the x-ray may not pick it up, whereas your fingers can tell you that. So in order to become really, really good at doing a physical exam on a bird, you pretty much need to examine enough of them so that you know the shapes, you know how the joints are supposed to move, and you know what normal versus abnormal is. Like, is this shoulder swollen? Is this leg, the leg that this bird's been standing on, have more musculature on it than the other leg that he's holding up because it hurts? Those sorts of things you can really pick up on a physical exam, and that can be difficult on an x-ray. So one of the blessings that you have in doing wildlife rehabilitation and having access to animals that don't make it is that they are your teaching tools. And they don't care whether or not you feel them and move their joints and body parts around, and learn from them, so that every animal you get, you should be able to identify their body parts and have a good idea what was wrong with them. And when I was first learning, I found it really helpful. The wildlife center I first worked with birds at had these great big diagrams of bird anatomy on the wall. And if you stare at them while you're feeling the bird and follow along, even though there's a lot of anatomic diversity between species, you can still get an idea that, like, okay, I'm feeling that bone right now, and there's an extra joint in the leg. So that sort of thing is really helpful when you're learning. So in my experience, initial care of any chick or debilitated adult bird that comes into care, you kind of have to do things in order, or else if you rush it, you can really cause a death of an animal. And this happens even at academic institutions like vet schools in the United States that are trying to treat wildlife, because a lot of times the students or whoever is working with the animal might be rushing to the diagnostics rather than stabilizing the animal first. I remember that happening with a brown pelican that came into a vet school, where they contacted me with what to do, and I told them what to do, and then they promptly went and knocked the animal out and took x-rays, and it died before it woke up. That sort of thing does happen. Rather it didn't. Whereas if they had waited until that animal was thermally and in all other ways stable, before knocking it out for x-rays, it may have lived. So a warm, well-hydrated animal is the best surgical candidate, the best anesthetic candidate, the best everything candidate for doing any diagnostics, frankly, other than taking some poop or a mouth swab. So warm them up and get them well hydrated before you do a whole heck of a lot else to them. All right, but before you do anything to them, they generally arrive in a box or in some manners that comes into your hands. And it's really, really informative to take a look at what's in the box. And the importance of that really can't be overstated. You can miss a lot if you just go grab them. You might miss the fact that they were holding up a leg or drooping a wing or holding their head upside down or any of the other weird things that we see in wildlife. So it also allows you to get a clue over what you need in order to handle that animal. Sometimes a very large and dangerous animal might be shoved into a tiny little box and want to pretty much explode out of it. So you can get an idea of what species it is, whether it is alert and instantly staring at you like it wants to eat you for lunch, or whether it is down and out with its wing twisted all the way around 360 degrees. It gives you a whole lot of information just taking a peek. Many times it'll give you a clue as to whether the animal has a fracture and which body parts are not fractured. So if it's standing up on both legs, that can let you know that those legs are pretty likely not broken. Very few birds will stand on a broken leg. It also gives you an idea of what their state of mind is. All right, so if you peek in and see something super life-threatening, like they're a giant blood puddle, or the animal's gasping its last breath, having a seizure, etc., it's a clue that you really shouldn't wait. You should act very quickly to stabilize them or make the decision to euthanize them if they are so bad off. You know, if their intestines are hanging out in the box or any of those other glorious things we find in wildlife. But if they do not have a immediately life-ending experience going on, the best thing to do is to let them rest. They have been grabbed by somebody and shoved into a box, and they may have been held on a child's lap for an hour or a day or 2 days, who knows? So bad things and stressful things have happened to that animal before it came to you. So letting it relax for a little while can make a big difference. And warm up. Most animals, at least in California, even though we have a very hot place too, most birds do arrive cold to our clinics. It's probably only a very small fraction of the passerines that were at previous centers I've been at that would fall out of the nest, bake on a sidewalk in the 100-degree, or what is that in Celsius? Oh geez, 37, 8, whatever, degrees on the sidewalk for a while before they come in. So these 3 surf scoters in this container are just the way they came into us. So the one on the left looks kind of like he might be dead or barely hanging on. The one on the right looks not so happy either, and the one in the middle is the best of the lot, most alert. So we would instantly know that that bird on the left needs some immediate care of some kind or other, either to make him better in some manner if we can, or to end it. So what do you see? Normally I would ask the audience for this. Let's let you look at that bird for a second. All right, so here's some stuff you could pick up just from looking at it in the box. Oh, it looks kind of like I had a pointer there for a second. Okay, so this bird has a traumatized eye probably. Looks like there's a little bit of a red look to that eyeball. It does look like it has a curve to it though, so it might not be completely ruined. Got a droopy swollen wing. The shape's a little weird. There might be a fracture in here. Oh, you can see my cursor. Yay. Right there. It looks like that doesn't look like his wrist. It looks like that's probably his wrist right there. So this might be a radius ulna fracture or a carpometacarpus fracture, something like that. He does have some fresh droppings in here. It's still wet. There's intestinal output in there, some nice green solid stool in there. So that means the bird ate fairly recently. So that gives you the clue that this animal has not been down on the ground for days and days and days. At least probably not. Someone did take the time to offer the bird a not inappropriate food with some mixed seeds there. The bird is not standing, but it is holding itself upright with its feet under its body. So if it, I have found that many birds with spinal problems, in my experience, do lay on their sides a lot of the time. They have trouble holding themselves with their sternum down, with their keel down. What else? There's no blood visible. That's good. All right, and then the bird has a possible head tilt. It does look like there might be a little head swelling too that's not mentioned here. So this bird may have a more significant head injury than just the eye. All right, so you get all of that from just looking at the animal. All right, so every animal that comes in has probably got a thermoregulatory problem. They might be cold, they might be cool, warm, hot, etc. As I said, cold or cool is usually the typical thing when birds come in for us. Small passerine nestlings, when they come in, they're usually ice cold. As a general rule, the tinier and more emaciated an animal is, the more likely they are to need a lot of heat support. And that's the case with big birds as well. So one of the mistakes regular vet clinics in California make with pelicans, even with geese sometimes, is that they assume because they're large that they don't need heat. And many times the pelicans that we get are just emaciated bags of bones, and they are, often too low for a digital thermometer to register. So many times these animals do need intense heat support fairly quickly. And we do generally just use your own warm hand to try to gauge temperature on a small bird. But remember that normal bird body temperature is hotter than you. So your hand can actually be too cool for the bird under pretty much all circumstances, unless your hands are like super toasty hot. I don't think they're that hot. Your hands aren't up around 40, 41 Celsius. At least they shouldn't be, unless you're in the hospital. So with larger birds, we do use digital thermometers. We use them a lot in water birds, and the tips can be a little hazardous. Only once in the last 30 years have I known of somebody actually perforating a cloaca with a thermometer tip. But we're pretty, rule-ridden with our volunteers so that they aren't, jamming it in there. They're just sticking the tip in, and it is way smaller than an egg for pretty much even a songbird. So taking the actual cloacal temperature works pretty well. For example, with our pelicans, we have them on thermal support if they are under, 103.5, sorry, Fahrenheit. Okay, so while the bird is warming up and calming down after its hard day, you can get your stuff together in order to plan to enter it into your records, create a medical record for it, get it a weight, and get your stuff together that you think you're going to need. So with that dove we were looking at in the shoebox, the ophthalmoscope there on the table is probably going to be a useful thing, since he does need to have probably an eye exam. And the more you prepare things in advance, the less the animal will have to sit there and wait for you to find the thing that you need while they're being handled. So getting ready in advance helps you minimize the amount of time you have to handle the animal. And that is a gratuitous pick of the cute little elegant tern chicks we've been dealing with by the literal hundreds, no, thousands, in the Long Beach Harbor for the last month, 6 weeks. It's been a long 6 weeks. All right, thermal support can be done in a whole lot of different ways. Those are our broken down incubators at one of our centers up in San Francisco. So each one of those units can be kept at different temperatures. We often have a broad diversity of all sorts of species in there. Depending on what you get, some of those Brinsea incubators are fabulous, little brooders. There's a whole bunch of different ways you can do it. You can also do warming areas that are super low tech with aquariums and heating pads and reptile heating bulbs, and those sorts of things work great in various circumstances. This shot on the right is from it looks like that's from 2012, when our Los Angeles Center had more than 600 pelicans come in over the course of 3 months. and we just plain old ran out of ordinary housing, so we ended up keeping animals in crates and ended up acquiring a horde of space heaters. So we put these birds on space heaters. That worked really well. We also ended up housing them in monstrous tents with space heaters. There was a little bit of a fire hazard, but nobody caught on fire, so it was okay. Yeah. So if you have special circumstances where there's a whole lot of animals at once, usually what we end up doing is we very quickly screen them for those that need instant euthanasia, and then warm everybody up, hydrate everybody, and then one at a time examine each and every one of them. So everybody gets a thorough exam, even if there's 100 of them. This also can happen sometimes at our other California wildlife rehab centers when like sometimes a teenager or a contractor will ruin a swallow roost. Like we got, I remember a day in Sacramento when we got 120 cliff swallow chicks at once. So this sort of thing can happen. And thankfully one of the city council members picked up all those chicks and brought them to us. So these things happen, and it is manageable. Even if you only see one bird at a time normally, you can upscale to take care of a lot of animals at once. It's totally doable. Okay, so once the animal's been warmed up, I need to assess their hydration status. So some animals are going to be extremely dehydrated and some of them are going to be fairly normal. So on the left is a northern mockingbird chick with nice pink skin. His skin is smooth. In your hand, that chick might feel soft, warm, and fleshy. Whereas the chick on the right, it's an American robin. His skin is all wrinkly. His flesh looks darker red than the other chick. And I think he also has a tibia tarsus fracture there. But in your hand, that chick might feel hot and like hard to the touch. It's not. It's kind of like you're feeling the texture of their flesh. Sometimes birds that are dehydrated will feel like their skin is shrink wrapped onto their body, and it literally kind of is. So it's a big indicator of their hydration status. It's not specifically like looking at capillary refill time or, so it's kind of skin turgor, but it's like the texture of the whole animal can give you a clue for hydration status. All right, there's a whole bunch of different ways to rehydrate animals, and which tools you use are going to vary by what species you're working with. So teeny weeny passerines. What's really popular in the US for many species are these little white cannula tips. They're plastic. They come packaged sterilely. They're intended for flushing wounds. They're teat cannulas. I guess they're made for cows, right? But they're perfect for feeding little tiny mouths. They do get washed like a dish until they break. They don't last all that long, but they get stuck on a 1 cc syringe or a half cc syringe. They'll fit on a 3 as well. With certain species that are really aggressive gapers, though, you really want to use one of those lure lock syringes where they screw on, because aggressive species can swallow the tips and yank them off the syringe. Something to be aware of. Starting small until you're sure that the animal can swallow well is generally a good idea. So we usually will start with, not sure if you folks think of volumes as percent of body weights or mils per kg, so I wrote it there twice. So 2.5 to 5% of body weight. Most animals can hold about 5% of their body weight in their gastrointestinal tract volume, assuming it's empty to start with. Different species are a little bit different. So, doves and pigeons, of course, can usually hold about twice that. Some of our seabirds can handle, if they're swallowing well and processing material well through their GI tract, more like 7%, but it depends on the species. But if you aren't sure and it's a new animal, you want to start small so you don't make them regurgitate. Let's see. So we tend to use at our clinics, just because the species we see are strictly water birds, we tend to rely on 1 cc syringes, 3s, and then we go up to 20s and 60s for some of the tube feedings that we do on our water birds. Of course, with a pelican, we just squirt the 60 cc syringe straight in the base of their pouch and just massage it down. We don't need a tube. Let's see. So in general, want to hydrate animals until they start passing urates and prove to you that their excretory systems are functional before you start sticking food in there. There are, of course, some species that we work with that will self-hydrate if they're given the opportunity. For example, ducklings, grebes, some of the water birds. We actually will swim them even when they're quite pathetic. We have warm water pools that we can swim them in. And a lot of times our large-bodied grebes will swim around and drink and drink and drink. And sometimes some of the really dehydrated grebes seem like they don't want to, they won't have a pass any urates until they're in the water, because I think the movement of their legs is really important to their GI tract. Anyway, so yeah, each species is a little different, but some generalities. There are also some other ways to administer fluids. Not sure which of you do which of these things. At the centers I've been at, like where we're dealing with all those cliff swallow babies, every single one of them got a sub-Q fluids right where that little starling there on the left is getting some. That's my favorite spot for passerines to get sub-Q fluids. You don't have to turn them on their back. I know a lot of people like to do it on the inside of their thigh for some weird reason. So that's the stretchiest spot. And if you hold the needle, it's kind of like parallel to his femur. His femur is right here, and that's his knee under there. So it's the same flap of skin as if you come at it from the other side, but the bird gets to be upright. Eventually the fluid under the skin will flow ventrally, and it'll end up over there anyway. But it's very easy to do with one hand restraining the chick and the other hand operating the syringe. You don't need multiple people. Another common place for people to do subcutaneous fluids on birds is on their back over their scapulas, so on the other side of this wing. And that's fine, but in many species it is not very stretchy there, so it's difficult to get very much volume of fluids in them. Whereas most birds can take a full 5% of their body weight right here, 50 mils per kg. So if you were going to do, a higher amount than that, I prefer to do that amount at different times per day. But if I know some people like to do 10% of their body weight, or 100 mils per kg, I would do that in 2 locations. Another thing that we do is IV fluids. We do IV fluids on water birds all the time. They come into care just as feathered skeletons, and they're super pathetic. Especially, we get a lot of large-bodied grebes. I've never worked with great crested grebes, so I can't tell you about them. But our Western and Clark's grebes are usually in really poor condition when they come in, and we do a lot of IV fluids. We do it as a one-off bolus, usually, maybe 2 or 3 times a day, but we don't place an indwelling catheter. Their medial metatarsal vein is super easy to hit on most water birds, and even on some raptors. For fluid choice, the animals that are in really, really poor shape with poor blood pressure, we will do half and half crystalloids and colloids. So that would be like a head of starch and lactated ringers mix is generally the volume that we do. And I have not had a problem with water birds with hemodilution from overhydrating them. I've bolused fluids into pelicans like a dog, and they say thank you the next day when they're standing up and looking at you rather than being unconscious and dead, deadish. So anyway, there seems to be quite a bit of variety in the types of fluids that species can take, or the volumes of fluids that species can take. I know some of the raptor vets I know do think that can be a problem in some raptor species. So anyway, know your species. There you go. And if the animal is cold still when you're doing fluids, make sure that you are making that toasty warm. It should essentially be their body temperature, which is warmer than you, to avoid chilling the bird with the fluids you're giving them. Okay, so here's a little summary of the fluid administration routes. I didn't really mention intraosseous. Intraosseous is where you put a catheter in, or a needle into usually either the ulna or the tibiotarsus to have an ongoing type of fluid administration, essentially straight into a vein. But I have had a lot of rehabilitators in the United States complain to me about the damage done to birds' wrists, carapaces, by veterinary clinics. So I tend not to advise people to do this unless, I mean, if you guys are competent at doing it, fine, and that's great. But novices probably shouldn't be practicing this on wildlife, mostly because they need to fly. A pet bird doesn't necessarily need to fly if their carapace gets screwed up by having a catheter in it. Anyway, so be nice to the wildlife if you want them to actually get released. So IV fluids are a little bit more more technical than subcutaneous or orally, but it's kind of amazing sometimes how much the routes that require needles sometimes don't necessarily improve the animal's prognosis for getting released all that much. I have known some rehabilitators who are just magic with doing nothing but oral fluids with tremendous patience and having that animal recover from the verge of death. And it's pretty amazing. So even when we had our 600 pelican winter, though, you know, we didn't have time to do IV fluids or anything on any of those birds, and they were all in horrible shape. So our staff ended up deciding, okay, small volumes every 30 minutes of nice warm fluids. That's what they got. And it's like everybody gets 60 mils of toasty warm fluids. And then once they perk up, then they can get other stuff. But just doing with small volumes of oral fluids can be very effective. So there are some risks with all of these methods. You might take a look at those there for a second. Yeah, you can't really do oral fluids if the animal can't hold their head up and swallow. Or you might drown them in their fluids. So aspiration is always a risk. There are also some volume limitations when the animal's super weak. It's more of an issue with mammals, but I guess you guys have cassowaries, so maybe you might not want to get anywhere near their face in some cases. And then there are some species that are at risk of swallowing their feeding tubes and tools. So there we go. All right, so there are quite a number of types of fluids that can be used. In a pinch, plain water can work, but it's really only good for oral fluids, of course, because it's not sterile. Pedialyte is nice, or whatever you call your unflavored pediatric electrolytes over there. Those are usually 2.5% dextrose with some other electrolytes in there, and they're usually just fine. Work very nicely for most species. One thing I'd caution you to not use is the World Health Organization human version of homemade electrolyte solutions because they contain table sugar, and there's a tremendous number of bird species that really don't deal with sucrose very well. The Pedialyte type fluids that do have sugar in them, it's not table sugar, it is actually dextrose glucose, which is a different type of sugar than sucrose, which you have to have a special enzyme to break down. So with sucrose, you can actually end up giving the animal diarrhea when you're trying to rehydrate them. So don't do it. There are some bird species that can handle sucrose fine, but they're vastly outnumbered by the ones that can't. All these other types of fluids are totally fine for whatever you need to do. We use quite a lot of colloids with some of our really poor condition birds. Let's see. Once you have given an animal oral fluids, you want to leave them alone to soak it up. It doesn't take very long. The studies that I've seen, it's usually gone from their gastrointestinal tract within like 20 minutes, even in a larger bird like a mallard. So the tinier birds, it's probably gone pretty quick. So once the patient's warm and at least starting to be better hydrated, it's time for their full exam. I know it's so much to do before you really start looking at them. It's really tempting when the animal comes in the door and there's like, you know his leg is broken, or something horrible is wrong with him, or he's begging for food to just leap in there and do that thing. But in many cases, they're going to be better off if you wait a little bit until they're warm and have had a little bit of liquid. All right, so performing a full exam, there are several options for restraint. It kind of depends on what species you're dealing with, of course, as everything seems to. For small birds like passerines, one person usually can do it quite effectively by yourself. Kind of get a handle on where your fingers go to restrain the bird. And a lot of times there isn't room for another person's fingers anyway if you're trying to actually feel anything with the animal. It's kind of awkward trying to do 2 people on a tiny bird. Although it can be helpful if you're trying to put a shoe or something on one to have somebody else holding onto it. 2 people is much more comfortable for larger birds. Most people do raptors with 1 person restraining and the other person doing the exam, so that somebody's always in charge of the feet and sometimes in charge of the beak. Some of them will bite you and some of them don't. At our clinics, we typically do across the table exams with 1 person restraining and another person examining. So I usually have a volunteer or a staff person holding animals for me when I'm examining things. You can either be on the same side or not on a table, and whatever works for you. Or during COVID, all of our staff got to learn how to do everything all by themselves, which is especially interesting when they had to do wound management on pelicans all alone. So it's a little challenging, but everybody managed pretty well. It's a little difficult sometimes to put a bandage on something while you're restraining it, but can be done. So you want to do a full exam. You need to do head to toe, but do it quickly. Don't take forever. So the longer you're holding the animal, the more stressed they are. But if you do it the same way every time, then you might not miss stuff. Like when everybody presents me with oh, we want you to look at this, I'm like, okay, let me look at the whole bird because I'm going to find the thing that everyone's missed, and I'm going to find, and I'm going to not miss the thing. The animal that I don't look at their shoulders on, that's going to be the one that's all screwed up and I totally missed it. So look at everything, try to do it in the same order every time so that you have a pattern and you don't miss things. So you're going to start with their eyes, ears, nose, throat, bill, neck, crop, etc., looking at everything. Shoulders. So shoulders are very complicated structures in birds. There's 4 bones that meet and make up the shoulders. And fractures in any of those things, or luxations, getting hit by a car, I'll talk more about those in the next talk, but there's a whole lot to find in shoulders. Originally, we had planned to have all this with a lab. Sorry, I'm a little far away for that. All right, and then wings, shoulders to wingtips for feeling everything, including all the range of motions of all those joints. The muscle mass at the keel is a very important thing to palpate. We do see quite a few birds with keel fractures. So you want to run your fingers along that keel and see what you feel. Spines, hips, legs, feet and toes are all places that animals have problems. Constriction wounds, hooks, fractures, you name it, everything happens to all these body parts. And one important thing to remember is to feel their abdomen. Although it's not very common in my life to run into animals that are having reproductive issues. Sometimes you might have a bird that's got an egg in there, might be having a repro problem. Also can be having injuries or lesions on their vent. So it's generally a good idea to take a look at it. You can do that if you're taking their temperature with a thermometer earlier, but if that hasn't been the case, it's generally a good idea to look at the vent. You can assess whether or not they have vent tone. They might have a laceration there, who knows? And then the range of motion of all of the limb joints is something to run through. And one of the unusual ranges of motion that birds have that us mammals, at least us non-Olympic athlete gymnast mammals have, is what's called dorsal dorsal abduction, where they can normally click their wrists together behind their back, which is something I can't really do. But it is a really important motion for flight. So that particular motion is often has deficits in animals that have been hit by cars in the shoulder. Of course, I work in Los Angeles, so as you might imagine, we have lots of gulls and lots of car hit gulls. So we deal with a constant stream of broken into a million pieces gulls. So when an animal first comes in, they might still be extremely stressed by your handling. So you might need to examine them in stages. And give them a break in the middle of it, especially if they have a lot of issues. So if a bird ever starts heavily breathing or open mouth breathing while you're looking at them, give them a break. Put them back in their nice, warm, quiet spot for a few minutes, 20 minutes or something, and give them a break. It's very stressful having a monster examine you. So there's a little mouth on a common murre. There's one of our volunteers weighing an animal. These baby scales, these are intended for human babies, so they have some limitations. They only measure in 5-gram increments. So we do have an assortment of other scales. You might bear that in mind if you normally see a certain size of animals, that your scales may not measure in appropriate increments, or go up high enough. If you normally deal with tiny things and you get a big one, you might have to deal with that. While you're doing the exam, remain aware of the way the bird is breathing. Now, if you're working with 2 people, the restrainer often is the person that can monitor this sort of thing, while the other person is trying to find all the problems. So you want to monitor that respiratory rate and effort. It's possible, especially when you're covering their head with a towel or something, that a bird can start to overheat. If the animal is in good body condition, it's even more likely that it might overheat with handling. There's one nice paper out there on that was on pet parrots, but it was showing that within 10 minutes of handling under a towel, a parrot could go from a normal body temperature to like super hot, gonna die kind of hot. So handling stress can really, really change the animal's body temperature. So that respiratory rate and effort are super important. And if you feel like there's a problem, just stop what you're doing, put the animal back. The air in a bird goes from their nares on the outside of their bill, generally, through the roof of their mouth, the choanal slit here. And then when their mouth is closed, that choanal slit lines up with their glottis at the base of their tongue. So that's the opening to their trachea. So they don't have an epiglottis to cover it. It's just right there. So when the mouth is closed, those go together. But this means that they cannot breathe when there is food or fluid in their mouth. So young birds that are weak and dehydrated may have trouble swallowing whatever you put in their mouth, and there's super high risk that they may aspirate. So you really want to keep an eye on their ability to swallow. And that's another reason why if you're hydrating an animal orally, it's often safest to put the fluid way deep in their throat rather than putting it in their mouth. We often run into issues with newer bird people who are, they're not really bird people yet, like the new volunteers who want to just like very delicately put something in the front of their mouth because they're scared to like stick it in there. But it's actually safer, deeper, get it away from their glottis. So anyway, might explain that to people who are new to the world of birds. Another important thing to know when you're handling birds, of course, is that they do have to move their keel to breathe. They don't have a diaphragm. So if you're super squeezing them, you actually can inhibit their ability to breathe, and that can screw up their thermoregulation, and they can end up dying from not being able to move their keel. So don't squeeze them by the keel, like spine to keel. That's bad. So again, I beat this enough to death. Stop and let the bird rest before finishing the exam if they're getting super stressed. Oxygen cages are helpful, but many of us work without them and they're fine. Okay, during the exam, you might need to give them breaks. Wound care is similar. If you have an animal that's been chopped to ribbons by a cat, a lot of times you can treat a thing, dress a wound, let them rest, dress a wound, let them rest, hydrate them, dress a wound, let them rest, etc. So mourning doves, I don't know if you have those over there, are common cat victims over here, and they come in with like no skin on parts of their body, but most of the times they don't mess up anything super, like they don't screw up their elbow. They like lose the skin on their back, which they can regrow. So a lot of times they are salvageable animals with horrible wounds, but they are very stressed by handling. So I consider that to be the least likely to die way to treat those animals is to do a little bit at a time, all day, just a little bit at a time. When you're examining birds, keep their head above their body whenever you can. That includes when taking x-rays for the vets out there. Birds have very minimal esophageal sphincters, and they are prone to gravity-dependent regurgitation whenever their head is lower than their stomach. So keep it in mind, because it can increase your risks of pneumonia and whatnot. All right, plumage is a really important part of a bird. We see all sorts of issues with it when they come into care. They might be stress marks. So these little horizontal bars here where the feather has a flaw, those are stress marks. They're also called fault bars, stress bars, all sorts of stuff. What it is a weak spot where the feather was growing. There was a problem, usually nutritional, or the animal was starving for a few days, or their nutrition was screwy, and they're probably going to break right on those lines. So then we have them come in with broken feathers along, and sometimes it might be along an entire row of fault bars. We also sometimes can see malformed feathers. An issue that happened when West Nile hit the North American bird population is that many of them ended up with feather abnormalities from West Nile infection. So those can be issues. There's also some parasites that can live in the feather follicles. They can end up with weird feather cysts. All sorts of weird stuff can happen with feathers. I already talked about burned feathers. We also see, especially as some of our oceanic conditions are being strange, we are seeing some seabirds come in that haven't molted on time. So the thought is that they're energy starved and they missed their molt, and then their feathers continue to age until they're just stripped and not flight worthy or waterproof anymore. So we had an event like that in 2015 with the warm blob in the North Pacific that you might have heard about, where we had 1,000 common murres come into care, and many of them were adults with terrible plumage. Anyway, also excessive pathogen loads apparently can lead to stress marks in birds. So sometimes urban birds or birds that are feeding in landfills can end up with some of those problems. Okay, so it is more like an organ than clothing. You really have to think about it as not something that is disposable and changeable. There are some animals, some species won't regrow feathers if you pluck them, or it will take a prohibitively long period of time. Like when I'm doing surgery on a grebe, for example, I only pluck enough so that there's a tiny little line so that they don't have to grow any new feathers in order to become waterproof again after the surgery. Because otherwise they have a big bald spot and they're going to get wet there, and that doesn't work. Same with flight feathers, tail feathers, etc. They're all super important, and every single one of these feathers is a slightly different shape, and each one has its own little role. They're not interchangeable, and that's a lot of secondaries. Pelicans have, our brown pelicans have, I think, 27 secondaries. It's a lot, and like 22 tail feathers. This is out in our pelican aviary. So, of course, the flight feathers in particular, are associated with certain sections of the wing. So the outer primaries, birds typically have 10, but they can have 9 to 16, depending on the species of primary feathers, and they're numbered from the carpus, from the wrist. There's a little tiny gap here at the wrist where that's the divider between the primaries and the secondaries, and they're numbered from there. So they both start with 1. So it's primary number 1 and secondary number 1 are next to each other. So it's 1 through whatever and 1 through whatever. So birds can have up to 40 secondary feathers. That's all species dependent. Although we did a whole bunch of plumage studies on our brown pelicans and found that they actually had quite a bit of variability in the number of tail feathers. It's like 20 to 23 when we looked at 100 different pelicans. So we see lots of plumage problems. Mr. Robin, American robin there on the left, has been chopped to ribbons, and I don't obviously see any wounds, but he's certainly been plucked. His wing posture isn't too terrible, so maybe he escaped without any fractures. And then this scrub jay over here also had a bunch of feathers plucked out. Sometimes traumatic injuries at the base of the flight feathers can lead to permanent damage to those feather follicles, and sometimes it doesn't. So it's usually worth treating the animal anyway to see whether or not they can grow some new feathers. I have found that pelicans with fishing line even if their ulna has been scraped bare, I mean, this is probably an unbelievable claim, but I have photos. Fishing line, back of the, like, wrapped around the radius ulna, and like 7 or 8 secondary feathers are absolutely trashed and gone, and there's just a gaping wound with bare bone. We can get that to heal, and they will recreate feathers. Those feather follicles will regrow, but they often are ingrown, so I have to birth them and create a feather pore, because that doesn't happen. So on these little tiny birds, when they have massive skin damage where the flight feathers are, they may end up with no feather pore for the feather to come out of, or the feather may not regrow at all. So far, the best of my knowledge, it's just our pelicans that are magic. I haven't seen that in any other species. We deal with gulls with similar problems, and they haven't been as good at regrowing things that have been completely wrecked. Okay, dirty plumage is another big problem. That can be a problem in giant wildlife shelters with numerous people feeding animals without good technique, especially if they're feeding some of the liquid diets. But a lot of times the finders will feed animals all sorts of weird stuff. Like I had a blackbird once that somebody was feeding uncooked rice and condensed milk. Like, why would you feed a baby bird that? I don't know. Anyway, and he was, of course, caked in dried condensed milk. Yeah, so there's some problems. Dirty birds can also be a sign that somebody's regurgitating. And sometimes when birds are regurgitating, they will fling it all over their neighbors and cage mates. So the one who's got stuff flung on them may not actually be the sick one, might be his neighbor. Another thing with big techniques of feeding can be an issue with giving the animal too much. Some birds, especially juveniles, will eat a lot, or they will eat more than they can hold and then regurgitate, or poop out droppings that look like undigested food. That's another sign of inappropriate feeding. Let's see, or maybe they just had a completely inappropriate food fed, like a dove that's been fed earthworms or something like that. I've seen that. Dirty plumage can be from all sorts of stuff. Of course, my organization is well known for being an oil spill organization. So we deal with oils all the time. Oddly, vegetable oils seem a little worse sometimes for getting an animal waterproof again. Glue traps can be horrible. I've dealt with attic insulation spray foam on screech owls. Man, that stuff's nasty. Pine sap can also be kind of a contaminant. There are infinite number of different contaminants that we can have to remove from animals. Sewage is one of the worst. And I do want to say a word about that, because that is a huge human health hazard for you. So if you ever have a sewage contaminated bird come in, please wear all the personal protective equipment you can find, like all of it, because that's some bad stuff in there. I mean, like viruses and who knows what. Yeah. All right, so some of these dirty birds need washing, even when it's just crusted food on their feathers, but you generally never wash a bird without stabilizing it first. There are some really, really limited exclusions to that. There are some petroleum products that are incredibly caustic, like diesel, or even like straight up gasoline, that can be really, really irritating. So sometimes we will wash an animal, do a really, really quick, not thorough wash if there's a really caustic substance on the animal, just to get the bulk of it off. But mostly they really need to be warm and well hydrated, and preferably not starving to death. So another issue to look at is plumage maturity, or whether the animal's in molt. These are blood feathers here. This is a western gull, and his primaries are not quite finished growing yet. They're also a little ratty at the end, but they're still in blood at the base. So this bird's wings are not quite mature yet. The rest of his feathers look pretty good. Some of this damage can happen if even like animal control or someone like that catches the animal and puts it in a wire cage for a short period of time. They can really trash some of their flight feathers really fast. Of course, you're going to assess the animal's state of nutrition. So pectoral muscle mass is usually the way people think of that, and this is kind of a south end view of the keel. So it's pectoral muscle. So there's rear ends towards you and the beak is away in both of these cases here. So this robin was pretty robust. Nice big plump pectoral muscle across there. This loon, however, despite his dense loony plumage, was just razor emaciated here. Super, super skinny. And one thing I've noted over the years with rehabilitators is that when you work with starving animals all the time, they seem normal. So you want to be aware that you are at risk for seeing emaciated animals or poor quality damaged plumage as being normal. And it really helps to see some normal healthy animals now and then. Is like, oh, is that what they're supposed to look like? Yeah, it can change things a bit. Okay, so you're going to be looking at eyes, ears, nose, and throat. They don't really have a nose, so they have those nares. So doing an eye exam is very helpful. An ophthalmoscope is quite useful for looking at eyes of all sizes. And here's a bird with the pelican on the right here, has problems with all sorts of issues. So this bird has a split mandibular symphysis and a big gaping hole in its throat that's making the fish fall out. We'll see that bird again later. So there are plenty of problems that can happen in that and in those parts of the body. Beak injuries are pretty common. Fish hooks are a terrible, terrible thing. This is that same bird once we knocked her out. With almost all species except a very few who normally have an asymmetrical bill, we have species known as crossbills, where their bill that has a scissor shape to it, and it's made for opening pine cones. But that's about the only species in North America. There's a couple different species of them. It's a group of species that are supposed to have an asymmetrical bill. Everybody else generally needs to fit together pretty normally. The birds species that have a really heavily keratinized bill for opening seeds, those are really prone to overgrowth of the opposite bill if there's chunks missing from one side. So those guys can be a big problem to release with bone missing on their bill. Most of the gulls are like that as well. They're very prone to keratin overgrowth on the opposite side. Some of the softer billed birds, though, aren't, like mallards, geese, pelicans. We had a pelican once that was missing a big chunk of the side of the upper bill, and like a third of the upper bill width was missing in the middle. And we ended up deciding to release her anyway. And since we had a band on her, we ended up getting photos of that bird for several years after release, and she was fine. There was no sign of a problem with her lower bill. Let's see. So during your exam, you're going to assess any lumps or bump scabs and try to figure out what the heck they are. So bear in mind that sometimes lumpy bumpy things can be contagious, viral caused or bacterial caused lumpy bumpy things. And sometimes they might just be an old wound. So kind of need to assess, what is it? What is it? Is it avian pox? Is it a wound? Is it abscess or a cyst? It also can be potentially a callus. Sometimes a former fracture will heal in a little lumpy area, and you won't quite be able to tell what it is. So just think about that whenever you come in and notice a lumpy, weird growth on an animal. So here's two. So this gull here has a little thing kind of on the edge of his bill, back towards the commissure of his mouth. And then this is a common merchick with another lumpy little thing on the top edge of his lower bill. So is either of them pox? Yes, this one was. And we usually get a ton of merchicks, and some of them do have avian pox, and we do euthanize them for this just because it is so contagious. And we have them in a pool. So having a contagious disease in a pool full of animals is a little odd. It's kind of hard to quarantine them. And then this was not. That actually was an old wound. It looked like he had a little cut where it flipped up a chunk of skin, and the skin was still alive, so it shrunk down into a little ball. So there we go. So every animal needs to have its skeleton palpated for fractures and luxations. We'll talk about more of those later. But even if you get a nest of healthy looking babies, you really want to look at every single bird. A lot of times when a nest falls, at least one of those chicks is going to have an injury. At least where I used to work at Sacramento at their big wildlife center that saw about 6,000 animals a year, whenever anybody brought us a nest of like 4 scrub jays, one of them always had a broken leg. Pretty much all the time. Or some of them might be horribly injured and other ones are completely normal. So it can go both ways, but just because they all kind of look the same doesn't mean they're all uninjured. And then this little house finch here had a broken tibiotarsus. So in order to identify wounds, getting a look at the skin is fairly important. And in passerines, you can puff on the plumage to part it at the rows between the feathers. But this is very difficult in diving birds because they don't really have those big spaces between the rows of feathers. A lot of times we'll end up finding wounds on grebes and loons just from their waterproofing problems. There'll be a spot where they're wet. And then areas that have matted feathers might be that they're covering a wound. That's pretty common that if there's an area where the skin is ripped, it often will become covered with dry feathers as a little covering. But it doesn't mean there isn't a horrible wound under there. It's just that it was wet enough that the feathers stuck to it. So sometimes wounds are obvious and sometimes they are not. So this is a pelican that was entangled in fishing line. He was actually out. He was caught by our folks out working with the elegant terns this last month. It took them like 3 days to bait this bird in so they could catch him because he was trailing lots of fishing gear. And he was standing on his digit number 1 abnormally, and there's nothing I could do to save that toe, so I lopped it off. So he's now a 7-toed pelican. So when you're doing an exam, though, if there's an obvious bad problem, you want to ignore it initially, unless it's instantly euthanizable, because it might make you not notice all the other problems the animal has. And you really need to think of them as the sum total of their problems and not just the thing that caught your attention first. But it doesn't necessarily mean that they are doomed if they have a horrible problem. So this is a jay that had a skull exposing skin laceration on his head. This sort of thing can be sutured. I know he's got blood within his skull, but still, if the animal's neurologically normal, I'd keep working with them and stitch that up. When you're handling wounds, please do wear gloves, mostly to protect the bird from you, not necessarily the other way around. You don't want to get your human staph bacteria onto their wounds. But many wounds in birds can heal very nicely. We do try to facilitate the fastest possible healing for the sake of their plumage condition, especially if they're a growing bird. The longer they are fighting an infection or dealing with trying to heal a wound, the more likely they are to have poor plumage consequences of that, with stress marks and those sorts of things. And then, of course, they need appropriate medication. So here's a gull we have in care right now. The fishing line through the commissures of the mouth causes some terrible damage here. Usually these heal very nicely, and they probably will. The only ones of these I usually end up having to euthanize is if the hook actually pierces the mandible. Those tend to go badly, but a lot of times they're just really ugly for a long time and they heal fine. Small problems on your small animals can be very significant. So this is one of those elegant tern chicks from Long Beach Harbor who had a swollen foot on one side, and we noticed he had this tiny little bone sticking out of his. So we were having problems with the chicks on the barges having fish bones in their feet. Go figure, who would have expected that to be a problem with a tern colony? So anyway, we've been treating a lot of little foot abscesses. And serious problems can be subtle sometimes. So this is a common injury that we see in Western grebes. They tend to land in concrete or be on hard surfaces when they're really emaciated, anemic, hypothermic, and the tissue over their joints, since they're not a species that normally stands on hard surfaces, tends to die. So all this matte finish here, the shiny scales are the live tissue, and the matte finish, this is dead tissue, and then that's a tendon showing, and this is an open joint. And he had another toe that was just like it, and his other foot was just the same. So I did euthanize this bird for needing to lose too many toes. Foot swimming species, it's like how much toe can you take off of a foot swimming species is a matter of some some debate. I'm usually willing to take off maybe one toe. That's about it. Okay, and droppings, of course, are also really important to keep an eye on in your animals. Whether or not they actually have intestinal output, you can get an idea of whether the animal has eaten recently, whether they look normal. So many passerines, at least our North American ones, probably yours too, many of the babies have a mucus envelope around their droppings so that the parents can remove them from the nest. So that is generally a sign of a healthy dropping. If it's smeary and stinky, that might indicate that the animal has diarrhea or something like that. We do deal with intestinal parasites, blood parasites, all of that, intestinal bleeding, etc. So a fecal exam can be prudent in many of the animals that come into care. And really important is to write down what you find. If you're a rehabilitation person who works by yourself, a lot of times it's really tempting to keep that knowledge just in your head so that you never, I've known home rehabilitators who never write anything down. But it also means that it's difficult to learn from what you did, and it's difficult to follow the case. If you want to consult a veterinarian or anything like that, if you have different caregivers taking care of an animal, or you need a pet sitter or somebody to come in and care for your animals while you go on vacation or something, or go to the hospital, who knows? It's very nice to have a medical record that someone else can read or that you could learn from later. Like the first wildlife center I ever worked at, there was this nice lady who did all the adult squirrels, and she dutifully come in and try really hard with every single one of them. This was in Palo Alto, California. And she tried and tried and tried. She didn't keep any personal records the first year I was there. And then the second year I was there, she did keep records. And we discovered that only one of those 99 squirrels that she was really breaking her neck to try to fix every single one of them, only one of them got released, because every single other one really was a spinal injury. So if you keep records, you can actually find out what you're doing and see what works and what doesn't work. And then when you change something, you can compare. It's amazing. So there are some online databases you can use these days. The WORMed Wildlife Rehabilitation Medical Database currently is free for anybody to use. There are plenty of places around the world that use it. It's very handy, and your veterinarian can, or the rehabilitator, whoever you're working with, can also log into the same animal's record. So it's very nice. There are a couple of others as well. When you're describing an injury, it's fabulous to use descriptive language rather than just saying something looks like it's healing. Those are actually kind of vague interpretive words, like something looks healing or healthy or whatever. If you say it's 5 by 8 by 6 millimeters, it's yellow and firm and it smells bad, that's actually a little more information. So if you were to describe this foot over here, so this was a western gull with an entanglement injury where it was above his hock, and a big chunk of his foot died. So this is absolutely necrotic, 2 of his 3 digits. And then this toe was still alive, but you might notice that this is a live dead boundary here. But this tissue doesn't look very good either. He's got kind of a second live. This is the live dead-ish boundary up here, little second boundary, where if he was only losing 1 toe, this is the sort of thing I might work with, but 2 toes, no, that would be a euthanasia because his foot's dead. Anyway, so live dead boundaries are a thing to look for. Also, when you have a skeletal injury, you want to make note of the state of the skin at that abnormality. Is the skin intact? It can make a big difference in the prognosis of whether or not the skin is actually in good shape at an injury, because the skin is forming a barrier to infection. Another concept that I really like to instill in rehabilitators is that you are using your fingers as a 3D imaging device. So whenever you have an injury, or like when I do surgery on an animal and it has a suture line, we train all our staff to palpate the tissue deep to that injury so that you can feel its depth. So every every injury typically has a three-dimensional nature, and figuring out what that is really useful. And it also can help you identify problems inside that may have been missed, like, oh, there's a fish hook and in his neck, and it feels like the tip is poking him in the spine. That sort of thing is something that you can feel. Or there's a tubular mass where some rescuer took a hook out and you don't know where the hook was. It's like, oh, I can feel a little hook-shaped tubular bunch of debris deep to the skin. So superficial means on the surface, and then deep is below it. So feeling that sort of thing is really informative and can really help you figure out whether an animal needs to have surgery or whether it's doing just fine and it's just a superficial problem. Okay, and to summarize, is Erica Miller. She was the vet at Tri-State Bird Rescue on the East Coast of the United States for many, many years. She's still active in the rehab community, but doesn't work there anymore. So she came up with this triage flow chart, and I just love it. So you start with an injured animal at the top. You get a history from the people who found it. You do your brief initial assessment, and you go one of three ways. It's either life-threatening, and you have to make a decision whether or not it's potentially savable or not savable at all, and that leads to euthanasia. If it's potentially savable, it goes to some emergency treatment for various things, like stopping bleeding, etc. If it was merely cold and dehydrated when it came in, then you're correcting temperature and then heading towards the fluid therapy route before you do your exam. And if it was a stable, well-hydrated, and conscious animal when it came in, then you can just let it sit for a few minutes, get your stuff together, and do that exam. And then there's three outcomes. So the animal either passes its thorough physical exam with problems that are treatable, and it gets a treatment plan, or it's not necessarily lethal problems, but it has poor placement potential. You can't really place it anywhere. Then it's probably going to end up getting euthanized. And then if an animal just has a huge pile of problems that are too many to treat, then it also gets euthanized. And I have found that species vary in how much damage they can take and recover from. Like our pelicans do great with lots of problems. Mallards do great. Pigeons do great. Loons do terribly. You know, there are definitely some species differences in how resilient the animal is to injury. And my final thoughts: practice, practice, practice until you are really, really good at knowing the shapes of birds and all the species that you typically work with. And if you have an animal that's not progressing as you expect, then you definitely should think of them as a new animal. It's like, okay, he's just coming in like this. What problems am I finding? Try to look at it with fresh eyes. And you can seek advice when you're out of your depth. That might be an animal that needs to go to the vet and have some imaging done, that sort of thing. Seek advice from your colleagues, like it's doing this weird thing. Could potentially go to another caregiver. And sometimes animals do have novel problems. I still run into things I've never seen before after all these years of working with wildlife. And it's also really important for rehabilitators to remember that euthanasia is not a failure. One of our jobs as people who deal with injured wildlife is relieving suffering. And if we have animals that are unable to return to being free wild animals, you know, euthanasia can be really a kindness. So don't beat yourself up if there's animals that you can't save. It's the nature of the business, unfortunately. And thank you very much for helping wildlife. Yay.